Both the humanitarian and the general situation in the Gaza Strip continue to deteriorate. Since November the 5th, all commercial traffic into and out of Gaza has virtually ceased, resulting in drastic restrictions on food and medical supplies. Fuel is scarce once again, power cuts are a daily occurrence, and water supply too is made difficult by the lack of electricity. Life-saving care in hospitals relies heavily on emergency generators. Upsurges in violence and restrictions on goods and travel are simply worsening what is already a dire and complex situation. The official Ministry of Health has not provided any drug deliveries for almost 3 months. Hospitals are extremely dependent on the limited support that international organizations are able to give them.
Also, there was the closure of the terminals, which are direct impact on the referral cases to the Israeli hospitals or the Egyptian hospitals or Jordanian hospitals. There was a massive decrease in these referrals because of blockage and closure. The shortage also of medication, because the medications comes from these terminals.
The fragility of the ceasefire between Israel and Hamas and the strike in the health sector declared this summer by the medical unions have had consequences throughout the hospital, including non-emergency surgery and patient referrals outside the Gaza Strip. Since the start of the strike, 250 wounded have received treatment in our post-operative care program, and the number of pediatric consultations is up by 25 to 30% a month.
The most significant factor is the strikes themselves. The strikes, this intra-Palestinian conflict. The health sector is totally dependent on what the NGOs, UN and other organizations are able to drip feed into the Gaza Strip. And that is of course very limited and insufficient to meet all the needs here.
MSF activity in the Gaza Strip has been extended in response to these needs. It provides post-operative treatment and mental health care to patients directly affected by the violence. Almost 5,100 consultations have taken place in our pediatric clinic in the north of the Gaza Strip since March 2008. Our medical teams have been strengthened in an effort to compensate for the deteriorating health services.